The audience, welcome to this special talk program. It's me, Rohan. Today we have our guest, Georgi Abraham, and he is the member of council, member of Society of Nephrology Council, and he is also the professor of medicine in Madras. Let me welcome him. Today we are going to discuss on the topic nephrology. So let me welcome him. Welcome, sir. Welcome to Nepal. Welcome to our studio.
Namaste, Rohan, and to the brothers and sisters of Nepal. And I am delighted to be here for the first meeting of the Nepali Society of Nephrology, and I have come as a speaker to interact with the Nepali nephrologists and the doctors.
Okay, so what is the main objective of this visit? What is this nephrology means? Can
the nephrology in simple terms means the science of the kidney. So I would, in my talk, I would address as kidney disease rather than nephrology.
Okay, so what does this mean?
Okay, what it means is that the science of the kidney is we are all born with two kidneys, and in an adult each kidney is about 150 grams, and they are situated in the back, low back. And these kidneys are very important organs in the body because they purify the blood and give you a healthy life. When the kidneys are failing, most of the time the people are not aware of it because
so what does this mean, the kidney failure?
Yes.
Can you please define it?
Right. A man, both of us are men, we are born with kidneys which contain about 800,000 to 1.2 million filters, which are called as nephrons. And in women they have a smaller number of nephrons, and these nephrons are the one which purify the blood of all the impurities. So if these nephrons are affected by diseases, they will lead to kidney failure, and depending upon the severity of the affection, the patient may present with either early kidney disease or late kidney disease. So what do these nephrons do? They maintain your blood pressure in the normal limit. They maintain your well-being, especially your hemoglobin levels. You know, we all look red because we have enough hemoglobin in our blood. When the hemoglobin falls less than 13 in a male or less than 12 grams in a female, we call it as anemia. So these kidneys are very important because they produce a substance called erythropoietin, which makes the bond to make the blood. So when the kidney fails, the kidney doesn't produce erythropoietin, so your hemoglobin level falls, you become pale, and then you will have tiredness, weakness, and other things.
So can we say that these are the symptoms of the kidney failure?
Yes, the other symptoms are when the kidney doesn't work, you develop swelling in your legs initially, and you notice that the feet are getting swollen up, and later on the legs also get swollen up, and you notice that you are passing decreased quantity of urine. The other signs and symptoms of kidney disease are when you pass blood in the urine, any drop of blood has to be investigated to see whether the blood is coming from the kidney or from the urinary bladder or somewhere in the tract. The third symptom is usually frothy urine. If you are passing frothy urine, it suggests that something is happening in the kidney or in the tract, so that this should also be investigated. And the other symptom of kidney disease is the kidneys are situated in the lower back, and if you have constant pain in the lower back, you should also go and get investigated. So I have summarized you what are the symptoms of kidney disease, and now how do we investigate that?
How do we investigate that?
Right. Who develops kidney disease? It is presumed or understood that 10% of the population in every country will have what we call it as chronic kidney disease. What is chronic? Chronicity means you have a scar in the kidney. The scar is usually silent. It is often progressive and unrepairable. So it is slowly progressive kidney disease, which is, we call it as chronic kidney disease. So what is the treatment for that? If you detect at an early stage, you have 5 stages of kidney disease. So the first stage is when your kidney function is 90% or more, and the second stage is when the kidney function is between 60 and 90%, and stage 3 is between 30 and 59%, and stage 4 is between 15 and 29%, and stage 5 is when your kidneys, both kidneys are functioning less than 15%. This we call it as terminal kidney failure, because at this point in time, when you reach terminal kidney failure, you cannot sustain your life without dialysis or transplantation.
So before that, we can treat it.
Yes. So the message I want to give is, any individual above the age of 40 should be tested for chronic kidney disease. How do we do that? I said that 10% of the population do have chronic. These are
that
done
is in every country,
every
or
country.
just in the developed
No, in every country. So this is what is understood because of the screening done even in Nepal also, because in Tharan, Dr. Sanjeev Sharma did a screening for chronic kidney disease, and he found that it exists even in Nepal also. So how do we do that? There is a simple blood test called blood creatinine level, tested in a reliable laboratory. Even if in an adult it is more than 1.2 milligram, it suggests that you have kidney disease.
Okay.
The next thing is check the urine. The urine is a mirror of the kidney function. If you have protein leak in the urine or persistently blood in the urine, this suggests that you have a disease of the kidneys. So these two simple tests can identify chronic kidney disease. And also you check your blood pressure, because all of us should have a blood pressure estimation done. When do you start checking the blood pressure? I want to make that message very clear. A child from the age of 3, every year a blood pressure measurement should be done.
From 3?
From the age of 3.
Okay.
This is the recommendation of the American Pediatric Association. Because blood pressure is normal in majority of the people, but in a subset of the people, you will have high blood pressure. High blood pressure has no symptoms. It is an asymptomatic disease. So unless you check your blood pressure, you will not know that you are suffering from high blood pressure. The next thing is, diabetes. Diabetes is high blood sugar. If the blood sugar is more than 126 milligram on a fasting sample, so you take the blood in the morning and test it before eating or drinking coffee or tea, and if the blood sugar is more than 126 milligram, you are suffering from diabetes. So the major causes of kidney disease all over the world are diabetes and hypertension. You have other causes like, familial kidney disease, and also people take alternative medicine, and they take too much salt, and they take painkillers, lot of painkillers. All these can give rise to slow kidney disease.
So these are the basic causes of kidney disease. You just mentioned about the family history as well. Does this family history affect the person or not in terms of kidney disease?
If you have a family member with chronic kidney disease, suppose, I have a relative who is getting dialysis, close relative. It could be a brother, a sister, or a mother, or a father. So these people also should have blood test and urine test done even at an early age than 40 to detect early kidney disease. Because if you detect it early, you can either reverse it or you can slow down the progression so you don't reach stage 5 kidney disease requiring dialysis or transplantation.
So these are the basic. You just mentioned about the stages of kidney disease.
Right.
Is there any types of kidney disease? How many types of kidney diseases are there?
Right. See, basically the kidney is affected by, as I told you, that the most common cause is uncontrolled high blood pressure and diabetes. So this affects the filter of the kidney. As a result, the filter becomes damaged, and then you can develop progressive kidney disease. There are others, because, for example, if you have stones in the kidney, if the stones are not being taken care of, and they can produce either infection in the kidney or blockage in the passage and can give rise to chronic kidney disease. Then I am getting old, and we are all getting old. So those who are above the age of 45, the prostate gland in men, which is situated at the bottom part of the urinary bladder, can enlarge, and it can block the passage of urine, which can have back pressure effect on the kidney, giving rise to silent kidney disease. So men with prostate disease should have a checkup done to make sure that they don't have kidney disease. And there are certain kidney diseases which run in families, or there are certain other kidney diseases which are congenital, because these congenital diseases
in the mother's womb.
Yes, this can be when most of the pregnant ladies, they go and get an ultrasound done, because as a part of the pregnancy follow-up. So when they do an ultrasound, they can also look at the kidneys of the baby inside the womb. And sometimes you find that the kidneys are missing, or only one kidney is developing, or the kidneys are blocked lower down. So this can be taken care of either in the womb in developed countries or immediately after birth in developing countries.
How does this the baby in the womb catches with this disease?
We do not know exactly the cause of congenital kidney disease. Certain congenital kidney disease, we know that, especially it is called the kidney develop multiple cysts, and these cysts can damage the kidney and they can develop kidney disease. So this is usually seen in adult. It is called adult polycystic kidney disease, which usually shows up later on in life. But there are other kidney diseases which can develop in the womb and soon after the birth. This is called the CACET. CACET stands for congenital abnormality of the urinary bladder and the tract, giving rise to blockage, because the child can develop blockage somewhere in the bladder or below the bladder, which will go unnoticed, which can give rise to progressive kidney disease. So this should be looked at. The best way to look at is by doing an ultrasound of the when the child is in the womb.
The baby.
Yes.
So can we cure or can we prevent this this kind of disease in the mother's womb? In the case
See,
of mother's
basically
womb
what in developed countries, when you find that there is blockage, they would go into the womb and repair it.
Okay. Do
So
we
that-
have such kind of system or not?
No.
In India or in India, since it is a developed
yes, it
country?
can be done in India in specialized center. I hope the same will be available in Nepal also in the future.
Can we say that this is all due to the family history?
Yeah. See, the congenital diseases, we know some that they are familiar, but we do not know about every congenital disease which develops in the womb. So it is difficult to say that because people are looking at genetic aspects of it and the genes, but we do not know much about that.
Okay, you just said that after 40, the people
Right.
just get this disease.
Right.
But what about the young people? Does young people get this disease or not?
Usually the high blood pressure and diabetes starts above the age of 40. But there are a subgroup of people who develop diabetes at a very young age who requires insulin treatment. So they can also develop kidney disease at a younger age group. And as I said, that there are certain inflammation in the kidney called glomerulonephritis. These glomerulonephritis, if not appropriately treated in the young stage, it can also give rise to progressive kidney disease.
Okay. So how can we prevent this disease? We just
Well-
mentioned about the stages, we just talked about the types. Now,
Right.
how can we prevent?
The best thing, the message is, treatment of terminal kidney disease is very expensive. Most of the developing countries and developed countries cannot afford dialysis and transplant. So as I said, the best measure is to go out into the community and screen the people in the community as they have done in Dharan by Dr. Sanjeev Sharma, and find out who has got silent kidney disease at early stage so that we can take care of their blood pressure, we can take care of their diabetes. If they have a stone disease, we can take care of them. If they have an inflammation of the kidney, we can treat them appropriately so that we can either cure it or prevent the progression.
What about in the second stage? How can we prevent in the second stage? First stage, that is just
Right. See, the second stage, as stage progresses, second and third stage, what we can do is to slow the progression of the disease. Once a scar has developed, it is impossible to revert the scar back to normal. So what we need to do is check up with a nephrologist or a family physician and make sure that they do not take medications which are toxic to the kidney or damaging the kidney, and follow up their blood pressure very meticulously and diabetic control very meticulously so that the progression can be slowed down.
And in the fifth stage, in the last stage, that
The
is
last
all
stage, once you have come to the
and the
once you have come to the last stage, you have only two options to live. One is dialysis, and the other one is transplantation. I was lucky enough to involve with the Nepali people, because when we started a home dialysis called the continuous ambulatory peritoneal dialysis in the 90s, we had nurses coming down to Madras to train in that, and we treated a number of patients from Nepal in this home dialysis therapy, whereby you don't need a machine, you use your own body's peritoneum for dialysis, and this is what is called the continuous ambulatory peritoneal dialysis, and they were living for years. Even I have some patients in Nepal.
How does this functions? Can you please?
Okay. What you have is, like this paper, you have a membrane called peritoneum which covers your intestine. This peritoneum contains a lot of blood vessels.
Okay.
So you put a dialysis solution which is made up of water, glucose and other chemicals into the peritoneal cavity. It stays there for 6 to 8 hours. During that time, through osmosis and diffusion, poisons from the body come out into the peritoneal cavity and you drain it out. So it is a home therapy, no machine is involved. Whereas in the Nepal Kidney Foundation, you have large number of patients being taken care of by Dr. Kafle, where they go there, they get attached to a machine and do it 2 or 3 times a day, which is called hemodialysis. Both these are blood purification for kidney failure.
Okay.
But the best treatment is a successful kidney transplant, because that gives you the best quality of life when you have terminal kidney failure.
How can we ourselves can prevent this disease?
See, as I already mentioned to you, anybody with a family member having kidney disease should have their blood tested for creatinine level, and also urine tested for protein or blood leak, and also have a blood pressure checked and make sure that your blood sugar is normal. Okay. And if you have a family history of kidney disease even at a younger age, these tests should be done in those people so that we can detect whether they have kidney disease or not. Now, so the simple message is that, you have very few nephrologists in this country, and you have physicians are also few. So you should go forward and say that, okay, I'm 40 or 45, please check me and look for whether I have a silent kidney disease, so that this can be taken care of.
Okay, so in that way we can prevent ourselves
Right.
from this disease.
Yes.
And you just said that this disease, the treatment of this disease is very expensive.
Right.
Why?
Because if you have to do, once you have reached terminal kidney failure, it is a death warrant. Invariably, it is lethal disease. So how do we keep them alive? We have to keep them alive through dialysis or transplant. Because if you do dialysis, there is a machine attached dialysis, as I said, hemodialysis, and the machine has to be imported, and the materials have to be bought and imported. So it costs a lot of money. In addition to that, you also have to take medications regularly to keep your blood pressure under control, dietary restrictions, and also erythropoietin to correct anemia, and other medications to keep you well.
Okay.
So all these will cost. This is a recurring expense. It is not curable. So you have to carry on with your dialysis and medications until you get a transplant.
So can you please focus on the transplant part as well?
Right.
Who can transplant? Or
Right. A person with an irreversible stage 5 kidney failure, the best treatment is a successful transplant. Everybody can get a transplant except those who have bad heart disease, because the bad heart disease is a contraindication to get transplant. Next one is those who have active cancer in the body, they cannot be transplanted. And if you have...
They can't donate the kidney or...
No, the recipient. I'm talking about
okay,
the recipient. And those who have active infection like TB, or they cannot be also transplanted, because you have to take care of that. And those who have severe blood vessel disease, the kidney has to be joined to a blood vessel. If you have no good blood vessels, you cannot. So these are the 4 areas where you cannot get a transplant done.
Okay.
The next question
now, what
is
about the kidney?
Who can donate
the kidney?
It has to be a healthy person with 2 functioning kidneys. Healthy means they shouldn't have diabetes, they shouldn't have any serious heart disease, they shouldn't have any cancer in the body, have active infection including HIV, they shouldn't be drug addicts. So these are the people who can donate a kidney. And in India, especially in Tamil Nadu, we have also popularized deceased donor transplantation. What is deceased donor transplantation? In India, every year, 1,64,000 people die of road traffic accidents. And 70% of them, when they are brought to the hospital, are brain dead. Brain death means they can only be kept alive on a ventilator for a few days and they will die. So these people are prospective organ donors. They can donate their cornea, they can donate their heart, they can donate their lungs, they can donate their kidneys, they can donate their pancreas. So when they are dying and they are brain dead, so their organs can be used for transplantation, so that they will give life to so many people.
So now you have been closely observing the condition in Nepal, the condition of kidney failure, the condition of kidney disease in Nepal. So what is your opinion on it?
No, the message I want to give is prevention is the most important thing. Those who have developed kidney failure and those who have stage 5 kidney failure, they need dialysis and transplant.
No, what is the condition of this disease in Nepal?
No, you have, I am sure that having had some experience with Nepali patients, you have diabetes, you have high blood pressure, you have other hereditary kidney disease in Nepali patients, and they require treatment, they require follow-up. but it is very expensive, and I think that philanthropists should come forward to support your government in giving treatment to these people who are suffering from chronic kidney disease.
So poor, what about poor?
No, it is, see, all over the world, if you look at that, you know, I published a paper in Nature Clinical Practice in 2008, December, writing about chronic kidney disease in Asian region. 95% of the people in the developing countries in Asian region cannot afford treatment, and as a result, they succumb to the disease. So suffice to say that we need to come forward and make more awareness about kidney disease so that it can be arrested at an early stage, even in the poor people. So that
there are no ways to make it more cost effective?
No, it is not. The only way to make it cost effective is if we start manufacturing the machines and the accessories in our South Asian countries, we can do that.
So I guess I think we have to wrap up this conversation because we are running out of time. Do you have some suggestion, or do you want to say something at last?
No, my message to you is that please be aware of the silent killer, chronic kidney disease, and please, if you are a diabetic or if you have high blood pressure, please keep it under control. And those who have family history of kidney disease, please come forward and have a health checkup done to look for chronic kidney disease. I think that is the most important message I want to give to my audience.
Thank you so much, sir, for giving us the time for visiting our studio and visiting to Nepal.
I want to thank the Himalayan television for kindly giving me this opportunity to speak to my audience, and also I want to thank Rohan for this excellent interaction.
Thank you so much. Thank you so much, dear audience, for your wonderful time. And today we focused on the kidney disease. Please do stay with us. Keep watching Himalaya TV. Namaste.